Well, our country is bleeding red ink. Since 2001, we've seen our national debt double from around $3 trillion upwards to $6 trillion. A deficit that has nowhere to go but up, as our federal government is spending billions in hopes of resuscitating an economy that's, well, it's in critical condition. Earlier, I visited with the national director of the Concord Coalition, a nonpartisan grassroots organization dedicated to eliminating federal budget deficits. Well, Mr. Smith, how much of a threat to the average American is our growing national deficit and national debt?
I think it's a larger threat than most people good at confronting the wolf at the door. If someone attacks us, we know exactly what to do. But this problem is more like termites in the walls. And we can put our ear to the wall, we can hear it there, but the house is still standing for now. But we're not doing anything about these termites. And the big problem, though, is what's yet to come, because the national debt is sort of a rearview mirror where we look at where we've been and where we didn't make the receipts add up with our spending in the past. But the future, it's going to be even worse, primarily because of the big entitlement programs that we have on autopilot and fiscal irresponsibility in general. We've got healthcare costs rising, the baby boomers are retiring. All these will drive the deficit and the debt to historic figures.
So, in fact, we may well be saddling the next generation with our own inability to handle this.
Well, that's exactly right. We hear a lot about the death tax when we talk about taxation policy, but we don't hear enough about the birth tax. When someone is born, no wonder newborn babies cry because they automatically inherit this huge debt. Because we're not willing to pay for our own government today, all of it, the next generation is going to have to pay for their government and part of ours today. And that's just simply unfair and it's immoral. So if you have children or grandchildren, or if you run a business and you want the economy to be healthy for a long time to come, these are issues that you should be concerned about. And when you see your member of Congress or a member of the Senate, make sure they hear from you, because they're always hearing from constituents who want more spending or they want more tax cuts. But they don't hear enough from people who say, please make sure those things add up so that the next generation isn't worse off than we are.
And it certainly is a hard issue in the fact that some of the entitlements that you talk about, Social Security, for example, lifted many Americans out of poverty.
That's exactly right. And in fact, I don't want anybody to misconstrue what I'm saying. Social Security has been a very successful program. Prior to its existence in the 1930s, seniors were the most likely group to live in poverty. Today, they're the least likely group to live in poverty, largely because of the success of the Social Security program. However, it's been put on autopilot with automatic adjustments that make the spending go up every single year. And because of that, if our population was maintaining itself like it used to, we'd be fine. But unfortunately, or actually fortunately, this is a good problem to have, people are living longer. And then that combined with this huge generation called the baby boomers that we've heard so much about, 77, almost 78 million strong in a country of only 300 million, are on the verge of retirement. And we just simply don't have enough younger people paying FICA taxes into the system to pay for all of these beneficiaries. And then that's Social Security. When you look at Medicare, it suffers from the same challenges of the baby boomers, but even greater challenges with the increased health care costs that we're seeing. So these are big, big problems, but as one president said, they're high-class problems. I mean, we're living in a great time, but we do have some big challenges that we've got to face up to that right now we've got our head in the sand.
So what is the solution, whether it be with the entitlement programs or with the rising health care costs?
Well, here comes the tough part. There's no silver bullet solution. If there were, I wouldn't be here talking about these issues right now. Politicians are scared to death to talk about reform options, because in order to fix these big problems that we're passing on to our younger children, it's going to take such tough medicine as raising the retirement age. Right now, Americans are living upwards of 1/3 of their adulthood in retirement years. That was never meant to be, but because we have this high-class problem of people living for so long, we've got to figure out a way to pay for it. So maybe we need to bump up the age of retirement. For me, for example, it's not going to be 65, it's going to be 67. Maybe we should bump that up to 68 or to 69. That would save a large amount of money. The Concord Coalition has looked at issues like means testing. You know, maybe that's a way of getting some savings. But it's probably going to require a mix of all of these options. One thing for sure, we've got to learn how to save better. We are a nation of very, very poor savers, and that does not portend well for us in terms of what we need to be doing in the future. No matter what type of policy we implement, if we don't save better as a country and on the personal level, we're going to be in trouble.
Let's talk a little bit about health care. Probably few would argue that the United States has one of the finest health care systems when it comes to the service that is available if you can afford it. There's many people that can't afford it, and it's a system that continues to grow, taxing both people and their employers.
Well, healthcare costs over the past 40 years have, on average, increased at 2% beyond inflation. If it does that over the next 40 years, then we're in for some serious trouble, because it will just grow so astronomically that it will take over the entire federal budget when looking at the federal government healthcare plans. But you know, we do spend a lot of money on healthcare in this country, but we get varied outcomes. If you look at some of the outcomes in some places in this country versus others, sometimes you get better outcomes for the less money you spend, depending on where it is, and sometimes vice versa. So I think we need to do a better job at folks that are maximizing the use of our scarce resources as healthcare costs increase. And we've got to look at some sort of outcome-based healthcare. But the healthcare thing is very difficult. When we were talking about Social Security just now, we're talking about numbers, we're talking about money, we're talking about retirement. But with healthcare, you're talking about life and death issues. And for example, the most expensive days of your life here on this earth will probably be the last few days of your life here on this earth, when heroic measures are taken to try to do everything we can to save your life. So when you're grappling with issues like this, you can see why the medical healthcare cost debate and reforming Medicare and Medicaid is much more challenging than the Social Security debate.
And if we choose to do nothing, this well could be a national security issue as well.
Doing nothing, frankly, is probably the worst option. So we have to entertain various remedies that are on the table now. There's some members of Congress that have put forth an idea to have a commission, and I know we've had a lot of blue ribbon commissions in the past, but there's an idea being tossed around right now. A fellow named Frank Wolf, a congressman from Virginia, and a guy named Jim Cooper down in Tennessee, that have put together a very interesting proposal that would bring together a commission of sorts and have the Congress have an up or down vote on a big reform plan for Social Security, and that may be the route to go. I remember the BRAC Commission, which looked at military bases and so forth, and they had to make the very unpopular decision to close down some military bases, and they were able to do that in a similar sort of way. So maybe that's the route to go, but you're right, doing nothing is the worst option.